We talked about family medicine, how much the average family medicine make, which is a lot higher now. Oh my God.
It was.
It used to be 150.
Exactly.
It's like 270 now.
Yeah,
that's
so they're
amazing.
around $270,000, $280,000. That's good money.
Welcome back, AJ.
What up, brother?
How you doing, man?
Good, man. How was
I
your
miss
week?
you. It's always good to see you, brother.
You too, man.
You look great in scrubs.
Thanks, man. I just got out of work, honestly.
Yeah.
It's pretty crazy. How you been?
You know how like they always say like nurses in scrub is like a hot thing? Are males in scrub a hot thing also?
I guess depends who's really rocking.
Because you look
right?
like a doctor and I don't. Like I look like I'm a rapper right now.
You do. You're about to fucking bust a rap right
and
now.
I like that you're wearing your watch and I'm not. That's
I
good.
know. I know. Yeah, I know. You'll probably be pissed later after the
I'm
episode
a little
is
bit
done.
angry right now and I really want to stop and go get my watch, but we're not gonna do that.
Where is your watch though?
It's in the car.
It's too much of a hike.
It's
We'll get
too
it later.
much.
We'll get it for the other episode.
Okay, next one.
Perfect.
That's fine.
Yeah, definitely. Man. Yeah, man. So today is going to be a fun topic. We're basically going to talk about doctors and salaries. I think you told me.
People are always asking, like, how much do doctors make?
I think a lot of the questions would be more for a lot of people who are probably still in college, want to go into med school, and trying to kind of understand of how much you can really make as a specialist or as just a general practitioner, a physician, or a primary care doctor as well. But
people don't know when you specialize. Doesn't mean that you make a lot of money.
Yeah, I agree. And there's always kind of that base salary, right, where of how much they really make and how much potentially you can make more. I think in general, anything that has any type of procedure, you could always make more money depending
100%.
on how much procedures you make. So I think both you and I agree on that. And you said earlier, we were looking over salaries in general. You said like CEOs are typically the highest paid. And then the medical field is the second
right
one,
under
right?
it, yeah.
So yeah, they do make a lot of money. Of course, depends on how hard you work. It depends on what type of specialist you're in. And we actually got a graph that we were looking at earlier from whitecoatinvestor.com. We found this graph and I thought it was pretty cool on how they made it. And looking into the realities and salaries of lower paid doctors, pediatricians are pretty much the lowest paid doctors in this type of field. So, but of course it varies, right? You have your endocrinologists, you have your infectious disease doctors, you have your rheumatologists. And remember, endocrinology a lot of it is for like hormonal therapy, thyroid issues, diabetes, etc. And then infectious disease, of course, is just, bacteria, viruses, fungus, and any types of infections in general. Oncology is cancer, rheumatology is rheumatoid arthritis, autoimmune issues. There's a lot of different factors to that, but in general, pediatrics is the lowest. Then we jump into like,
that's sad.
Yeah, it is, unfortunately. But I think a lot of it, like we said earlier, has to do with like Medicare, right? And
they have Medicaid. Most babies have.
They have Medicaid or private insurances and with their parents.
And it's hard because people say, well, peds is easy because the baby's not talking, for example, like young. But you have to deal with the parents.
Yeah, 100%.
And I will say the parents of a baby is much harder than an older patient that we deal with.
I agree. But you also have to, I don't think it's easier, to be honest with you. I think it's harder because he can't talk.
Yeah.
The baby can't say anything. It's like, okay, what do you feel?
He's going off of symptoms.
They're crying.
That's it.
You're going off what the parents are saying.
Yep.
And sometimes the parents are just agitated because they don't know what's going on.
Yep.
So, and that's what it was. So the next one would be around, and let's go back. I mean, that pediatric population, physicians, they typically make between like $220,000 to $250,000. Now, jumping into the next step would be more of you got the geriatricians, family medicine, sports medicine, child neurology as well, preventative care, geriatrics. We talk about that, endocrinology.
Since we talked about family medicine, how much the average family medicine make, which is a lot higher now. Oh my God!
It was.
It used to be 150.
Exactly.
It's like 270 now.
Yeah,
that's
so they're
amazing.
around $270,000, $280,000. That's good money. I mean, it's a starting salary.
I feel like that's a little bit high, but I think they're putting it. That's like as a medium, because there's some people that do make 200.
Yeah.
And there are some that are making 500.
Yeah,
right?
Exactly. And then the next one will be more into like the infectious disease specialist, the internal medicine, occupational medicine, and rheumatology. They make approximately $300,000 a year average base salary. So those are the numbers. And remember, like I said earlier, a lot of it has to do with also procedures if you're doing it in the office as well. And of course, how many patients you see. We don't work on fee for service. We're a managed care company. So
what does that mean, managed care? Like, can you describe?
We basically handle the patient's care, whether we see them 5 times a month or twice a year, we get a lump sum per patient, depending, of course, on the patient's symptoms. I mean, coding and what their past chronic medical conditions are. So for us, it's a lump sum every year versus, you get paid per visit,
Yeah. I mean, keeping them healthy, keeping them out of the hospital is crucial. So it's a little bit different than fee-for-service, and people sometimes are like, why are you preventing a patient from going to the hospital? That's not how you have to look at it. You have to look at it as we're trying to keep you as healthy as possible to keep you out of the hospital. Who likes going to the hospital?
Nobody.
Nobody likes going to the hospital.
I mean, unless you really have to, right?
There's 24-hour on-call doctors. You can always
exactly.
ask them. And that's what makes me and you different, is that we spend time with our patients, we talk to our patients, and we try our best to keep them as healthy as possible to keep them out of the hospital.
Fact. No, I agree. I agree 100%.
And keep them away from unnecessary medications.
Yeah, or testing.
Yeah.
Or
I mean,
testing.
for me personally, I'm trying to avoid giving too much meds because I'm noticing that a patient will come in with a symptom and then I treat it, and then now they have a side effect from the medication, and you can't tell, is he getting worse or is it just a side effect from a medication? And I really don't like pushing medication unnecessarily.
Yeah, I agree. Especially like during the flu season right now, everybody wants an antibiotic, and it's honestly driving me crazy in the office. I mean, I'm getting literally minimum 30 to 50 phone calls a day for patients that just want antibiotics.
It's viral. You're positive for influenza or COVID. Why are you asking for antibiotics?
They will never understand. They said, well, last time I took a Z-Pack and I felt better the second day. No, it's because you've been sick for a week and a half.
Yeah.
And now you're just getting better naturally.
Yeah, 100%.
You know what I'm saying?
Look, guys, if it's viral, antibiotics, antibiotics, it's not going to help a viral symptoms. It has to be bacterial. Now, there are people, again, we've talked about this in the last episode, that transition into a pneumonia, which can be a bacterial pneumonia, and we always treat that with antibiotics. But if you have a simple cold, you're positive for influenza, don't ask for antibiotics. It's really unnecessary.
Yeah, because you're getting the risk of all these side effects from these antibiotics.
100%,
Kidney
becoming
failure,
resistant.
stomach issues, diarrhea, C. diff. There's so many risk factors of taking unnecessary antibiotics. So just stick to the regular, tea, lemon, honey, ginger, Tylenol if you got a fever. Get some rest, hydrate. It's just you got to give it time. Viruses could take weeks, honestly, for you to start feeling better. So,
100%.
And remember, of course, the healthier you are, the better your body can fight this type of infection too.
And the less you have to see these specialists that we're talking about.
Exactly. And they make more money.
We talked about the lowest paid, and then I think what everybody wants to actually hear is the highest paid. Nobody really gives a shit about the lowest paid. These are the big dogs. Everybody wants to hear it. So I think I'll start with like the lower end and then go up, and then that way we leave the highest paid till the end.
Sure.
Now, the last three, I feel like I always argue that who makes more. So nuclear medicine, 392,000, pulmonary, 400,000. We'll kind of go down the path. Oncology averages between 440 to like 600,000.
Yes.
My thing that I feel like everybody loves the most is dermatology, right? An average dermatologist makes around 460 to 700,000. I mean, that can range so much, but derm is awesome because
For sure.
how many dermatological emergencies are there? Like, think about it. They don't really have emergencies, and most dermatologists I know have a great lifestyle.
Yeah, they do.
That's why you always see the good-looking moms going to the derm, because they work 8 to 4, Monday through Thursday.
Chilling, not on call.
Yep. And that's why I feel like derm is one of the most competitive specialties in the world.
For sure.
Everybody wants to do derm.
Yep, it is. And you know what? And the dermatologist that has skin products that they sell at their office, look at the sky's the limit. It's all procedural.
Money. And now
biopsies.
with the beauty stuff, oh my God.
Great.
Botox, fillers, all of those.
There's
Derm does great.
many
Hair
things.
loss, like we talked about, derm does that.
Yep.
So derm specialty, I feel like, is just, I honestly think it's harder to get into than like plastic surgery.
Yeah, I agree.
Because people want that beautiful lifestyle. ENTs make good money too. ENTs are averaging around, what this is saying is 480,000. GIs make a lot of money. Gastroenterologists, guys, those are the people that deal with like abdominal pain, do colonoscopies, endoscopies.
Yep.
The money is in colonoscopies.
Yeah, it is.
That's why every GI specialty wants to do colonoscopies.
Yep. And everybody over the age of 50 should get a colonoscopy. So imagine how busy they are.
Money.
Yeah,
There's a lot of money in GI.
For sure.
Radiology, if you're a type of person that does not want to, deal with humans and don't want to talk to patients, want to sit in a room and just,
and
look
make
at
$500,000 a year.
make $500,000 without dealing with any patients, that's the person for you. That's the specialty for you. Next coming up is urology. That's your favorite.
Yeah.
And that's dealing with penises. AJ loves that.
Yes. Shout out to Dr. Omar
honestly
Hamoui
am
and
shocked
Nabil
that you didn't
Hamoui.
go into urology. Yeah.
Well, I mean, I got kidney stones, so I see my urologist often.
lot.
And shout out to Dr. Omar Hamoui and Dr. Nabil Hamoui, by the way, one of our good friends. And I think they're fantastic urologists, and I trust them 100%. And yeah, I'm sure they make tons of money, you know?
Is it true that people with kidney stones, like, does it feel like women are delivering? Like, is it like equivalent? Now, obviously, you're not a woman, but do you think it's equivalent?
So I've had patients who are women who've
you've
had
had kidney
babies,
stones, that's
who've
what I was
had
trying to say.
kidney stones, who actually said that kidney stones were more painful than when they were in labor.
Wow.
So, but then you also, there are more
How big
women
are they?
that
Yeah.
tolerate being in labor. Some women don't. I mean, it's still painful. I just think just the way the kidney stone is just coming down and just scraping you is extremely deadly.
Oh, I've never seen grown men screaming in pain than kidney stones.
Yeah, it's the worst pain
And
in the
also,
world.
people don't understand, like, the smaller ones are worse sometimes because they're bouncing off of your ureter. If you have a big one just stuck, that's not as painful as a small one, like a little diamond scratching all the way down
scraping.
your ureter. Oh my God.
You know, that's a very good question. For all our women patients who've had babies and who've had kidney stones,
Which one's worse?
which one's worse?
Let us know.
Kidney
And we'll put a
stones
poll in there.
versus
Can
labor.
we finally put a poll for once?
Yeah. Well,
What's worse,
we'll put a
delivery
poll.
or
we'll have them choose. We'll
Thomas,
have Thomas
please
kind
help
of
us
take
out
out.
here.
Yeah, Thomas will take care of that. So kidney stones versus labor. Which one's worse pain?
And it's worse for men because, especially like men like me, that they have to go through all the way down the 11 inches, all the way down to get rid of the stone. So for women, you know, their urethra is so small.
It's so disgusting.
And for us, it's maybe not for you, but like for men like that have a larger penis, it takes forever to get through there all the way to urinate.
I know. It's just fascinating how just proud you are.
Yeah.
It's proud. That's awesome.
I
Good for
actually
you,
never
man.
had a kidney stone, so I just jinxed myself.
Yeah,
Because a lot
good.
of the time is genetics, and
You're
it's
gonna
coming.
get it.
Oh,
Yeah,
please,
Dad
God,
has
do not give me a
Dad
kidney
has it.
stone. I
I've
don't
had
want
it. Grandma
I don't
had
want
it. You're gonna have it. Watch.
And you
for
can't
all
wait for that
shit
moment,
talking,
huh?
For all that shit
I'm not
talking.
shit talking. I'm just
It's shit
saying it's
talking.
probably easier for you.
I
that's
know,
all.
bro. It's just you're measuring penises. We can measure penises afterwards.
We'll
It's
deal
not a
with
problem.
measuring penises later. Sorry.
Okay,
All right, we got into that. We talked about GI radiology. We talked about urology. Cardiology. Cardiology, they're saying the average cardiologist makes $544,000 a year. Now, it depends if the cardiologist specializes in vascular surgery.
Yep.
They do like stents. They do all
For
of that
sure.
stuff.
Yep.
Cardiology is a very important field. We love our
Aneurysms.
cardiologists. Dr. Roxwell, Dr. Akel, all of
Yep.
them in the field. I respect cardiologists. That's a hard
bro,
field.
It's tough, bro. Both of them, bro. They're so hard working.
They work
and
hard.
They're so busy. And I mean, echoes, stress tests, cardiac caths, and a lot of vascular procedures too. Tons of them, bro. Atherosclerosis and peripheral arterial disease. And
Oh my
vascular
God,
disease.
it's a lot. It's a lot.
It's very common, especially in our smokers. So
Smokers, cholesterol.
oh yeah, a sedentary lifestyle. I mean, it goes on and on. The list goes on and on for sure.
I think people don't understand that smoking is like, let's not just talk about cancer, like amputations.
Yeah.
I feel like the one thing that scares people in order for them to quit is amputation. Like, yo, imagine getting your foot chopped off.
Yeah.
That scares the shit out of people.
and diabetics too.
Yeah.
Yeah, well, I mean, it's kind of like if your circulation process is a highway, and you're smoking and you're sedentary, you're just basically causing traffic, right, for the blood supply to just get to wherever it needs to get for it to heal. So think about it. If you have a bad infection in your toe and you have poor circulation, it's going to take forever to heal, if it even heals, if it doesn't get worse. So
because you can't get oxygen to it. Again,
Absolutely.
oxygen transports through blood, and if it's
Exactly.
not getting
It
there,
heals.
it doesn't heal.
It has to heal. So that's why exercise is very important, because it circulates.
100%.
Exercise, get up, walk, move.
100%.
You know?
The next thing is oncology.
Yep.
Oncology. I feel bad for oncologists. It's really, really difficult to be an oncologist.
Yeah.
Dealing with cancer all day and people
horrible.
dying and radiation, chemotherapy. I
So
really,
sad.
I feel like people in that field, imagine having to be an oncologist and every day you have to deal with, hey, do you want to do chemo or radiation or do you not? Or there's a chance of dying, and they don't have an answer. They don't know how long you're gonna live.
they don't. Nobody
I
has the
never
answer.
tell somebody how long they're gonna live. I just
You
don't
can't.
do that.
You can't.
And I
And
think it's
patients should not be
unfair.
asking, because it's just not fair.
It's not fair.
So
We're not
I mean,
God.
listen, there are certain guidelines and research and facts that, for example, like prostate cancer. Pancreatic cancer. That is just such a horrible type of cancer.
Yeah.
And they say, yes, the average is around 5 years, depending on the stage.
Some
But
people
you
die
don't
faster.
know. Some people. I've had patients over 5 years that lived, and I've had patients that didn't last a year. So it really depends on you.
Yeah, pancreatic cancer is horrible. I feel
horrible.
bad.
It's horrible.
And for anybody that's watching and that does have cancer, we're praying for you and we love you.
Yes.
And continue to watch us on DocTok.
Doc.
Okay, so the next one is oral and maxillofacial surgeon. Those are like, they make big money
They
because
do.
they're dentists and doctors, right?
Yeah.
Like they're MD
And DDS.
Yes. DDS, which is pretty cool, man.
Yeah, my buddy Sanjay, his brother is in Chicago, and he's a MD DDS, and he's a maxillofacial surgeon.
That's amazing. They make money, man.
Bro, great money, and a lot of it is trauma too, right? Like post accidents and stuff. So think about it. I mean, these guys are banking, man. These guys are.
But it is a hard field. I will say that is not
fact. Yeah, fact.
The next one is vascular surgery. We kind of talked about that a little bit with circulation. Plastic surgery is not number one, guys. Plastic surgery is number 4 on this list. I have seen lists before where plastic surgery is number 1. They're saying that the average plastic surgeon makes $571,000 a year. I think they make more than that. But plastic surgery is a really cool field.
Yeah, it is.
I think
fun.
they specialize forever, man. They take forever to finish.
They got to do general surgery first, and it's an art.
God.
It really is an art.
It's a long time. Now, number 3 on the list is orthopedic surgery. I've seen that number 1 on many lists.
Yeah.
On this list, it's number 3, but I've seen orthopedics is just climbing more and more and more. Everyone needs hip replacement. Everyone needs knee replacement. Orthopedics are killing it, and we love our orthos.
Yep. Daniel Moynihan.
Dr. Moynihan, he's an amazing doctor.
He's a fantastic orthopedic surgeon. He's one of my favorites.
So number 3 is ortho. Number 2 is thoracic surgery. People that have open heart surgery.
Yep.
Those guys are typically very mean doctors. Sorry.
Yeah, I've had a good one.
Why are they so mean?
I don't know. Dr. Wall is pretty famous in this area too. But
Everybody loves Dr. Wall.
Dr. Radahali, he's I don't think he's working as much, but he's a fantastic thoracic surgeon too, man. He's a great guy.
I will say they're nice compared to most.
They're nice, man. I like both of them. They're really great, and they're very smart and hardworking, and they're badasses. So yeah, man, shout out to them. But they make tons of money too.
Tons of money. And that's number 2, guys. And number 1, drum roll. Neurosurgeons. I'm sure everybody thought McDreamy would be on there.
Yeah, for sure,
So neurosurgeons average almost 800,000. Most of them make about $1 million.
Way more.
And so neurosurgeons, it takes a long time to complete. It's minimum 7 years of residency. Yeah. And that is not easy to be working on the brain and brain tumors. Sure. It's a very hard field. The spine. Yeah. That is a very hard field. But I will let you guys know between neurosurgery, which is number 1, thoracic surgery, which is number 2, and orthopedics, number 3, those fluctuate so much.
They do.
So for everybody that's watching, that can change. Every year it changes. This is the one they set for 2023. If you guys think that this list is incorrect, let us know. And,
and another thing, though, also you have to take into consideration, like the lower paid, the highest paid, too, is because they have higher risk, too, man.
Insurance malpractice.
They get a lot of lawsuits. I mean, I think the average is, 3 to 5 lawsuits per specialist in that field. So, and it's going to happen. But it's just such a demand. I mean, we need good surgeons in this area. So
everywhere, yes.
Yeah, man. So that's basically the salaries. I think that was a pretty fun topic.
If there's something else that you guys would like us to discuss regarding specialties, we'll be more than happy. For everybody, make sure if you love this content, you like this kind of stuff, follow us. Follow us on TikTok, Instagram, YouTube. Watch our old videos. Show us some love. We would really appreciate that. Honestly, we love you guys.
Yes, and honestly, for a lot of the specialists, if you guys watch this and you want to get on the show, send us a DM. Let us know who you are, and we can collab. I think it'll be a great idea to talk about surgery in general. So it'll be fun. Let us know, man.
Awesome. Thank you, guys.
Have a great night. Thank you.